It's time for the Drugless Doctor. Call a friend or family member now and let them benefit from today's exciting and life-changing program. If you want to lead a healthier life, the time is now.
Hello everybody, I'm Dr. Anthony DiMaria and I'm joined with Dr. Casen DiMaria, and we have another exciting episode of the Drugless Doctor. And today, this episode, we're going to be talking about one of our favorite things, pregnancy and pediatrics. Now I know Dr. Casen and I have been working over the last several years with some postgraduate training in pregnancy and pediatrics. Now we get really excited about these two population groups for a variety of different reasons, but we're going to share with you some of the benefits of working with pregnant women and with pediatrics and kids, because when you'll see and what we'll discuss, you'll see that these decisions that we make will positively impact these groups for a long period of time. So Dr. Casen, talk to us a little bit about why we see pregnant women and kids as chiropractors.
What's so exciting is with working with pregnant moms, and even prior to them even getting pregnant, we work with making sure that the brain and the nervous system is healthy and responding. And you think about how important that is, especially if you're getting pregnant and you're developing this baby. You want to make sure that everything is in that proper communication. Now, specifically with our pregnant moms, the pelvis, you want to make sure that your pelvis is in that proper position to make sure that the baby has optimal positioning. And as chiropractors, we do a specific type of analysis with our pregnant moms called the Webster Technique. And the Webster Technique specifically is an analysis of the pelvis to make sure that everything is in that proper position. And when working with the spine and the nervous system, what you'll find is the sacrum, which is that big triangular bone, that's the foundation of your whole spine. So if your sacrum is not in that proper position, then you have a greater chance of not having that positive birth outcome. And with working with our pregnant moms in our office, we have a lot of conversations as far as things that they might not even be aware of during their pregnancy because they're not hearing it from their healthcare provider, whether it's their OB that they're working with. A lot of our moms come into the office and they don't even realize how chiropractic can help to benefit them and make them have an easier pregnancy and also having a better outcome with labor.
Now, I think you made a couple of great points there, Dr. Casen. Most people don't even realize that there's alternative approaches to pregnancy and pediatrics, because over the last 50 or 60 years, most people resonate or have resonated in the past with OBGYNs and pediatricians. Now, when we are communicating with people and we have pregnant moms and kids that are in our office, they are starting to realize that there's another approach. And a lot of times when we're having those conversations, people never realize that they could have the health outcomes that they desired and not need to go to those other providers. So it's great because we can help to improve function in their body through chiropractic care and making some other great decisions. Now, I know that one of the things that we were recently reading some research on from the Cleveland Clinic, and they said that over 80% of every pregnant women, or I should say all pregnant women, 80% are going to have some sort of low back discomfort or immobility during the course of their pregnancy. And what they're finding now is they're looking to alternative providers to help manage pregnancy. Now, there's a variety of different things that we do with these populations that is different with someone that's not in a pediatric population or not pregnant population. And most people don't have that information on how we're able to work with those groups. So first, talking about children, whenever Dr. Casen and I are talking out in the public with people and we're mentioning that we work with kids, and they'll say, well, why would a child go and see a chiropractor? Well, just like Dr. Casen mentioned at the beginning, we're working with them because of their nervous system and working on getting them well and keeping them well. What's really great is we see so many tremendous things with kids, but we use very gentle and specific adjusting techniques with children in the office, just like we do with pregnant women. Now, one of the things that we do with pregnant women is we use pregnancy pillows. Now, Dr. Casen, talk to us a little bit about what pregnancy pillows are and why it's important, because most women don't even realize that this is how we would work with them when they're in the office, because they've never seen anybody have this done before.
Well, our pregnancy pillows, this is one of our pregnancy pillows and what it looks like. And if you see it, what it has this nice cutout, and it is memory foam. So whether our moms are in their first trimester or second trimester or third trimester, we have another pillow that we're able to stack on top of this so that they're able to lay comfortably on our table in a face down position. Now, these pillows are so comfortable. A lot of our moms, they ask if they can take them home with them because they want to be able to lay in that position and be comforted. But the pillows really allow us to have that exact analysis of the sacrum and the pelvis to make sure that we are being very specific in the adjustments. And with our pregnant moms, because of the relaxin and the hormones and the physiology of everything changing, the adjustments are very gentle and specific. And by being very gentle and specific, we're able to get the maximum results. Now, some of the things that we can work on improving during pregnancy is, of course, the labor process and making sure that the mom is able to progress and have those contractions, but also overall mobility and range of motion. We had a pregnant mom recently, and we were doing her reassessment to measure all of her improvement, and she said, "Dr. Casen, I can't believe it. I can touch my toes, and I am going to have a baby next week, and I was not able to do that prior to even getting pregnant." And the results that we're seeing with being able to make sure that the moms feel comfortable and confident, it's not just the physical being of a mom, but also emotionally and physically, we're able to be that support system for them. And we work with a lot of other midwives and OBs in our area that we have a lot of great connections to be able to get them to the resources that they need to help have that birth outcome that they want and that their significant other has. Also, something I want to talk about is it's not just the pregnant mom, but it's a team effort. So when a mom first comes into the office, we encourage that she brings her spouse with her or her significant other so that he can be a significant part of the whole birth process. So being able to do exercises with both of them and showing them why it's so important to make wiser food choices really helps impact the overall outcome of the newborn baby that's going to be coming into the world.
Now, I know that the question that we get quite often is, when should a pregnant mom come into the office to get chiropractic care? Well, the very best answer is before even considering becoming pregnant, because a lot of times when we're working with pregnant women in the office or trying to get pregnant, is they have health outcomes and desires that they really need to achieve before becoming pregnant. Now, this is important because as soon as a lady gets pregnant, she's now working for two. Everything that was going on in her body is now magnified because the nutrients that she has are going into developing that new baby. So it's very important that if someone's considering getting pregnant, that they start with a health plan in order to get their health to the optimum peak performance before even considering to get pregnant. Because a lot of times when someone's not healthy, they might have a miscarriage. So we see that quite often in the office with people that are having miscarriages. It's the body's way of saying, hold on a second, we need to make sure that we're getting healthy so that we can have a favorable outcome with this child. So the very best would be to be before pregnancy. Now, if you are already pregnant, we encourage people to start at the very beginning of their pregnancy. One of the reasons why is the first 9 weeks are the most important time of a pregnant woman's entire pregnancy, because that's the time that the fetus is growing. So by the end of the 9th week, the baby that's inside mommy's belly is already as large, I should say, as formed as it's going to get. The next 2 trimesters are just growth inside mom's belly. So those first initial 9 weeks are really important. I know later we're going to talk about why some proper nutrition is really important, and those 9 weeks are so vital. So when working with pregnant women, it's that initial phase of getting pregnant that's really important. Now, as someone progresses in their pregnancy, it's like Dr. Casen mentioned earlier, is optimum pelvis performance and positioning for an individual. One of the reasons why is you'll have reduced back labor during your pregnancy. Also, the baby will also be in the optimum position. These are all things that we see as a result of pregnant women coming into the office. Now, we've had communication with midwives, and we've worked with midwives quite extensively, and they will always tell us that women that get chiropractic care during their pregnancy always have a greater amount of outcomes. Now, if you've been enjoying what we're having to mention, go onto our website, Drugless DRS, go to the section that says blog, and look for the outline that says pregnancy and pediatrics so you can follow along. We're going to take a short break, and we'll be right back.
I'm a chiropractor because my goal, my passion is to help people get better without medication.
There's different types of chiropractic. I wanted to be involved in something that was bigger than myself.
Sure, I would say it's been so much more than just seeing those lives transform. It's been being able to be a part of their transformation.
Wellness is a state of mental, social, and physical well-being.
Really, wellness is from the inside out, being able to have your body make the decisions on its own, naturally, without drugs, medications, or surgeries.
We work and strive at addressing each one of those different facets of wellness so that it's really a well-rounded overall approach for an individual.
I think the atmosphere is really very welcoming. I think all three really work well together as a team.
It's much more than you would find somewhere else. The individuality of it, the recommendations, the doctor's expertise.
We do not use a cookie cutter plan. Every person that comes into our office is very unique, and they have specific plans and treatment protocols specific for their findings.
Utilizing our innovative tools and technology, we're able to get the best results and faster, and it's really easy on the practice member, specifically with the thermal scans that we do. By measuring the ambient skin temperature, we're able to measure from each assessment how the pattern's changing.
We offer digital video fluoroscopy, motion films of a person's spine, getting right to the root cause.
From someone that was previously diagnosed with ADHD and was having developmental delays in speech, working with them here and seeing the transformation of them developmentally, other things, attention span, energy, colic, all these things that are improving over a period of time.
So whether it's a little baby that's getting adjusted for the first time, or a mom that's getting adjusted, or an athlete, it's really cool to see what we're able to do and how that can impact their life for the long term.
The two things, chiropractic care and nutrition, go hand in hand, and you really need both components. You can't just say, I'll do whatever I want nutritionally and then just have chiropractic care and Dr. Bob will just fix me. Really, you have to have both going together.
In our wellness store, we offer a variety of different products. They're all professional lines and products that are tried and true. We have many different types of evaluations and assessments that can tell us what supplement is going to be best for one of our practice members here in the office, so that we're just not throwing the dice when it comes to their health.
The Drugless Doctors is very forward-thinking. It's a lot different than anything else that I had ever seen before, so I felt like I was learning something new.
We have information on social media, our website, our blog. We do TV programs, so we're always putting out good quality information, because more often than not I hear from somebody, I never knew that, or I got that information from a magazine or a TV program and I never really knew that that wasn't correct.
So being able to give them simple tools and natural principles that they can be able to empower themselves to make every day, that's really, it's really exciting for me to be able to see people and their changed lifestyles.
Come and join us and participate with natural drugless chiropractic care.
Hello everybody, welcome back to this episode of the Drugless Doctor, and we've been talking about pregnancy and pediatrics. Now, these are two really important populations that their health decisions are magnified throughout the course of their life. So we've been talking briefly about pregnancy, and there's a couple of things that I wanted to add to what we were already mentioning. Now, if there's someone that's having a hard time getting pregnant, there could be a variety of different reasons. One of the things that we find commonly is misalignment of the lower part of the spine, of the pelvis, and the nerves that go to the ovaries and other female organs are really important to make sure that they're checked, because if the brain's not sending those right messages to those organs, a female's not going to be able to get pregnant. We also work a lot with ladies nutritionally in order to make sure that they're getting the right nutrition in order to get pregnant. So we've been able to help many women get the pregnancy that they want and be able to get pregnant in our office through chiropractic care and also through some proper nutrition. Now, we love working with pediatrics, and it's a tremendous population because they respond so quickly to chiropractic care and they have such great outcomes. So Dr. Casen, talk to us a little bit about what we do with kids and when is it important to get your child checked by a chiropractor.
One of my favorite things about being a chiropractor is having the ability to be able to make sure that our future generations are healthy and they're happy and they're making sure that their brain is sending all those healthy messages. Now, the best time to get checked is when you're first born. So right away, coming out of a birth canal, you want to make sure that the baby's brain and nervous system is 100% functioning and responding. And when we're first born, we are like a ball of nerves. So being able to do very, very gentle and specific adjustments to the baby is so important for overall health. And the pressure and the adjustment that we use with kids, it's no more than the pressure that you would put on your eyelid or that you would place on a tomato. It's very, very gentle. Now, with kids, when they're first coming out of the birth canal, whether it's a natural vaginal delivery or a C-section, there is trauma to our spinal cord either way. And that compression coming out of the birth canal is able to, whether it is hindering the function of breastfeeding or digestion or having colic or reflux or sleep, all of these things can directly be improved with making sure that they have proper function. Now, some of the times when parents first bring their child into the office, they might have told us, hey, they said that the child was 100% when they were first born. They had a great APGAR score, which is an assessment that they do first when you're born, or they seem happy and healthy, but we may find other areas that we can work on improving function, because not necessarily will a little Johnny say, hey mom, I'm subluxated right here where my brainstem is from the doctor pulling me out, and that isn't the case. So we want to work on improving function on all levels. And what's really interesting, I think that you should share, Dr. Anthony, is the grandparents' response or members in our office seeing kids that have never seen kids get adjusted before.
Well, I know that we have a family practice, so it's very common that we might even have 2, 3, or 4 generations of practice members in the office. So it's very common that I'll have a grandparent say, well, my grandson or daughter is having these challenges and they don't think that anything about it. And I said, well, you know that we work with kids and we're able to help improve function in their body. Well, how do you do that? Well, it's all through the nervous system. So when their grandchildren come into the office and they start to see positive outcomes, I always hear from grandparents that say, hey, you know what? I haven't had to go babysit for the last 2 weeks, or little Johnny's not coughing or is able to sleep through the night or doesn't have a runny nose anymore. So it always gets me really excited because they didn't even realize how function can be improved in their little grandbaby via their son or daughter. Now, it's really great is children that get chiropractic care are happier and healthier than other children. I always hear it from practice members that are bringing their kids in that their young one is the healthiest in their class. They're the most alert. They're the fastest learner. One of the reasons why is because it's helping improve nervous system function. Now, I know Dr. Casen and I, being healthcare providers in this age range, we see it very commonly that even in schooling nowadays that they want kids to be further along than they ever were in the past. So it takes a group effort with mom and dad and grandparents in order to get the child nice and healthy. And it's really great when we have kids that are coming in for wellness because they're going to be able to hit those milestones that they need to, so that they won't ever be held behind, or they won't have something develop like ADHD or autism. So we see we see quite a few children for wellness in the office, and it's really cool to see their outcomes over time. Now, I know that we mentioned earlier that we were going to talk about some nutrients that are important during pregnancy, but also for children. So there's a variety of different things that pregnant women should be utilizing in the office. Now, one of the simplest things that anybody can do that's pregnant is prenatal packs. Now, when should someone start using the prenatal packs? It's before they're deciding to get pregnant, because this is going to have the nutrients that your body needs in order to help grow the baby. Now, the prenatal packs are really great, but there's also additional things that we recommend that pregnant women utilize as a part of their pregnancy in the office. Now, there's a great multiple vitamin, and it's called Biotrophic Plus. It's always very common that we have someone get pregnant in the office and they ask us, well, what can I or shouldn't I be taking? We always say start with the prenatal packs, but we encourage them to get an additional multiple vitamin called Biotrophic Plus. It's one of our very best multiple vitamins because there's no glandulars in it, nothing that would be contraindicated during pregnancy. Now, there's a few other things and items that are important during pregnancy is to have the right level of omega-3s. Now, optimal EFAs is a great blend because it's got 3, 6, and 9 in it. So we encourage people to do at least 3 of these capsules a day, or a tablespoon of liquid, on top of their prenatal packs. Now, another item that's in the prenatal packs, but you want to make sure that you're getting an adequate level of, is vitamin D. We use a liquid vitamin D in our office called Biodemulsion Forte. You want to be doing between 1 to 2 drops of vitamin D on your tongue daily, along with your other regime. One of the items that we also encourage pregnant women to utilize during their pregnancy is iodine. What it is called in our office is iodazine. Iodine is really important for proper neurological development in a child. There has been research that shows that children that have trisomy 21 or mental retardation is a result of not having enough iodine during pregnancy. So just to review a few of those things for those pregnant women that are taking notes right now, is you really want to get the prenatal packs because it's got everything that you would need. We encourage people, however, to go above and beyond that so you're supplying your baby with the right nutrients. Biotrophic Plus, optimal EFAs, vitamin D, and iodine are your perfect regime while you're pregnant. Now, we get this next question quite often is, now that I have a little one, what can I do to help support them with good, proper nutrition? Now, what do you have there for us, Dr. Casen, for the pediatric population?
Now, before talking about making sure that your little one has the proper nutrition, the importance of all of this is that the things that you may be getting or seeing from, whether it's your OB or in the store, is not always the best ingredients. So Biotics Corporation that we utilize is a professional line, which means there's no gluten, no dairy, no preservatives or chemicals in it, so that you can get the full benefit for yourself and for your family. And most of those prenatals or other items that you're seeing for a multiple vitamin, whether it's the Flintstone vitamins or pregnancy vitamins or women's health vitamins, a lot of them have true carcinogens in them, which they may not tell you. So the next thing that we're going to talk about are a great multiple vitamin for children is the Aqueous Multi Plus, which from our experience, this is great because it tastes really good and it's a liquid. So you're able to mix this up in water for your child and it tastes really good, and even you could make your own sports drink with this and some Celtic sea salt to give to your child to help with overall minerals and vitamin B support. Now, the next thing that I'm going to talk about is calcium magnesium. And this is really important, especially for minerals for growth. So you might have someone in your life right now that they're having growing pains,